Good morning. My name is Jane. I'm a dental hygienist and founder of Knowledge Oral Healthcare. So thank you very much for taking the time to hop into this webinar. So I'm hoping this webinar is going to run about 40 minutes, and that's allowing for Q&A time at the end, and I'll do my best to stick to time. So apologies if I look a little bit distracted at the beginning, and that's because I'm doing this solo. So I'm going to be accepting people as they come into the webinar, but and talk to you at the same time. So as I continue accepting people, what I'll do is I'll outline the content of this webinar, and I'll give you a bit of a brief outline, intro about myself. So now I'm assuming that I've got people here that are either an oral champion, or maybe you're considering becoming one, or maybe there are people that are just curious about what the role entails, or perhaps you're just interested in the compliance aspect. So now we've been delivering the training aspect of oral health care in care homes, community service, hospice, hospitals, learning disabilities, basically any person that delivers personal care. And we've been doing that since 2015. And it's only recently, I would say, that an oral care lead or champion has become popular. And that's really since CQC announced that they're reviewing oral health care, which I'll talk about in a moment. So now care homes are particularly keen to appoint an oral champion, which is great, but I've yet to come across anyone that feels confident in what the role entails. So that is the whole reason for this webinar. Now, before I get started, what I would like to say is this webinar is not oral care training. Okay, so we've done a few of these webinars, and we get a number of emails at the end asking for a certificate in oral health care. Although I'm happy to issue certificates, so if anyone wants a certificate after this session, if you can pop your name and email address, I'll send one over. But it's not oral health care training. It really is the role of an oral care champion. So actually, let me just go through the learning objectives, and then you can just disappear if you feel that it's not going to give you all the information you want. So we're not going to go over the mouth care aspect of things, tips and coping strategies, or products and mouth care management for palliative care, etc. So what I'm going to do is I'm going to give you a very basic understanding of the importance of plaque removal, because for some vulnerable adults and long-term care facilities especially, the task of toothbrushing isn't necessarily to prevent decay, and I'll talk about that in more detail in a mo. I'm going to give you some examples of where poor oral health have made headlines. I'm also going to give you an example of a care home provider who failed in oral health care. So just that you can be better equipped with regards to the CQC stuff. So I'll obviously talk about the role of an oral care champion and the quality standards, and I'll give you some best practice advice with regards to some popular questions that we get asked. So with regards to me, I'm a dental hygienist. I've interviewed many care staff to find out how they find brushing other people's teeth, their perceptions of the mouth, and for a study that I was carried out. And one of the things that I did do was initially I went into two care homes, a residential and a nursing home. And whilst asking questions, the care staff went very quiet on me. And I since then found the reason they went so quiet is because mouth care wasn't being carried out. So when I carried out oral health assessments within these homes, I found lots of decay, broken teeth, dentures that have been in the mouth for years, not months even. And some of these staff, residents, didn't even have a toothbrush. And so I did wonder whether it was just these two homes. And incidentally, by the way, the owner of these homes was a very proud lady, very proud of her homes, was a patient of mine, was slightly horrified that this was the case. So that's kind of what got me started, really. So there have been other studies carried out with regards to asking the similar sort of questions. Staff didn't see the importance of mouth care. They had difficulty accessing the mouth, particularly to people that are more challenging, and that was a big learning curve for me. So people were, as people advance with dementia, quite often they become more resistant to mouth care. So although seemingly toothbrushing is fairly straightforward, we brush our teeth every day, it's quite a straightforward thing to do. But when you're approaching somebody who doesn't want to have their teeth brushed, it becomes a completely different ballgame. The carer's perception of brushing residents to be seen as infringing on their personal space. Now, what I would like to say is people are keeping hold of their teeth for a lot longer. So they're coming into care homes, hospitals, wherever it is, with more and more of their own teeth. Now, in the old days, it quite often used to be a case of having a bucket of soapy water, cleaning the dentures and handing them out. But those days have definitely sort of gone. In 1968, a third of the population aged 65 and above were edentulous, basically had no teeth, so they often come in with full dentures. And today they reckon it's less than 3% of the population aged 65 and above have no teeth. So we're retaining our teeth for a lot longer with crowns, bridges, inlays, implants. Not that you particularly need to know what people have got in their mouth, just the fact that people are keeping their teeth for a lot longer. So I'd like you to have a look at this picture and let me know whether you think this is a healthy or unhealthy mouth. Okay, so I'm just going to get the poll up. Right, what do you think? Healthy or unhealthy? Okay, so we've got exactly 20% say it is a healthy mouth, and 80% of you say it's an unhealthy mouth. A lot of people will look at this picture and will say it's an unhealthy mouth because they're looking at the fillings and the restoration. So for those of you that said it's a healthy mouth, you're right. So yes, this person did have dental disease, but it's all been restored. As you can see, they've got gold inlays at the front, a crown, they've got some amalgam, silver fillings at the back there. But what you need to do is you need to look at the supporting tissues, and remember it's the gum and the bone that support the teeth. So this is a 72-year-old gentleman with a healthy mouth. The gum is pale pink, it's firm, it's stippled. So we would consider this a healthy mouth. This is what we would consider an unhealthy mouth. So this person has no restorations, no fillings, and they've got galloping gum rot, basically. They've visibly got plaque in their teeth, and the gums have reacted to the plaque. If this person was to brush their teeth, their gums would bleed and their gums would feel possibly quite tender. Most people, in actual fact, end up losing their teeth through gum disease and not through decay. So this don't when you're assisting somebody with toothbrushing and you're looking in their mouth, don't be concerned about what they've got in their mouth. Don't worry about how many fillings and bridges, etc. they've got in their mouth. What you need to do is look at the health of the gum. So healthy mouth, pale pink gum, and this is an unhealthy mouth. Lots of, gum disease, inflamed gums, etc. So this is an unhealthy mouth. It's important that you realise the difference between the two. Okay, so it's not the fillings and things you should be looking at. So on that note, what exactly is plaque? So this is the white sticky stuff that sticks to our teeth. This is why we're brushing our teeth, to remove this stuff here. Okay. So I'm not going to get another poll out, but when we do ask this question, a lot of people say, oh, it's bits of food. Okay, so you can starve yourself for a whole week and you'll still generate plaque, whether you eat or not. So after brushing your teeth, literally hours after brushing your teeth, you'll start generating plaque. Now, hopefully you've all brushed your teeth this morning. About 3 to 4 hours after brushing your teeth, you'll accumulate something called the pseudomembrane. It's the slimy stuff from your saliva which sits around the neck of the teeth. You've always got bacteria in your mouth, be it good or bad bacteria, and it sticks to that slough. And that is the matrix of plaque. Now, if you eat foods that contain sugar, the consistency becomes thicker and so it matures. But essentially, plaque is bacteria. Okay. So if you've got somebody that is peg fed, you know, you're in a nursing home, you're in a hospital, you've got somebody that's peg fed, they're not consuming anything via the mouth. They will still generate plaque, whether they're consuming anything via the mouth or not. I really like this slide. And Professor Ian Chappell, who's you know, a specialist in gum, a gum specialist, has very kindly allowed me to use his slide. And what I really like about this slide is emphasizing that the mouth is a hidden place. So if plaque is allowed to sit on the gum for a period of days even, it causes microscopic ulcers on the inside lining of the gum. Now, if your gums are inflamed, and obviously depending on how inflamed your gums are, the amount of inflammation in your mouth, if you took the mouth out of the body and placed it on your leg, this is what it would look like, obviously depending on the amount of inflammation you have in your mouth. But what it's emphasizing, what I'd like to emphasize here, is you wouldn't ignore an ulcer on the leg, you would attend to that. But unfortunately, the mouth is a hidden place. They say that you can't have a healthy body if you don't have a healthy mouth. Which is true. If you've got gum disease, you've got inflammatory markers floating around the body. So yeah, you need your mouth to be nice and healthy. An oral champion is not expected to be an oral health expert, but you should have a basic understanding of what is needed for good oral health. And like I said outlined in the learning outcomes, the aim of plaque removal is to lower the bacterial levels in the mouth. This is for the elderly in long-term care facilities. And what you want to do is you want to prevent life-threatening conditions such as aspiration pneumonia. So if you've got bacteria, if you've got plaque in your mouth and it's not being removed, obviously it's going to mature. It's going to mature, it's going to mature. And then what's going to happen? It's going to get inhaled to cause an infection in the lungs. Lots of poorly people in care homes. Lots of people in care homes that are admitted to hospitals with pneumonia, chest infections. A lot of people die from pneumonia. And there's a study which is over 20 years old now, which I just plonked on here this morning actually, is it's from Japan, where dental care professionals went into 9 nursing homes over a period of a year and attended to people's mouth care. And the incidences of residents being referred to hospitals with pneumonia dramatically dropped. And as you see the headline here, oral care reduces pneumonia in older patients in nursing homes. And I just wish that they would do some more of these studies. It's the biggest study that I know you know, in the past 20 years. So on that note, what I was just going to brief on this as well, because I find this quite interesting. So after going into many care homes with residents, some of these care homes have nearly 100 residents, and you do think on the grand scheme of things that the care home will be phoning up the dentist every 5 minutes with people with raging toothache, bearing in mind that residents are coming into care homes with existing problems, with decay and broken teeth. And that generally isn't the case. So they're not always phoning the dentist all the time. And if they are, it tends to be from, you know, relating to broken dentures and that kind of thing. So what I'd like to point out is this. As we get older, our teeth become less sensitive with age. So let me just explain. So the outer part of the tooth is enamel, that's not sensitive. The bulk of the tooth is made up of this yellow stuff here, that's called dentine, that is the sensitive part of the tooth. And right in the middle of the tooth, you've got the blood and the pulp supply to the tooth. Now, cells are constantly being laid down. This yellow part of the tooth, dentine, cells are constantly being laid down. So this dentine gets thicker and thicker and thicker with age, which means that the blood supply and the nerve supply to the tooth, as we get older, gets smaller and smaller and smaller. So although there's no odontology data with regards to this, I would say that when we get to our sort of mid-80s onwards, we've pretty much lost the sensation to our teeth. The sensation to our teeth has reduced dramatically, which is why when I was looking in people's mouths with lots of decay and broken teeth, people weren't in a lot of pain with them. And you and I, if we had, decay, broken teeth, we'd be straight on the phone to the dentist. Now, I would go so far as to say that if an elderly person has got oral pain, the first thing that I generally tend to do is I look out for ulcers with loose dentures rubbing on the soft tissues, or maybe a broken tooth rubbing on the soft tissue of the tooth. And that can be really, really painful and be enough to stop people from, eating. So if someone's got oral pain, look at the soft tissues as well as the teeth. Making things that would make poor oral health that was making headlines. I'm just going to highlight on a couple of these. This one here. Poor oral hygiene partly to blame for the death of an elderly care home resident. So there was an elderly gentleman that died when a post-mortem was carried out and they looked at the mouth. The bacteria levels in his mouth were very, very high. It was described as a green slime in his mouth. And poor oral hygiene or poor oral health was a contributing factor to his death, it was said. So an inquest was carried out, and when the care manager was questioned, she said, well, he kept resisting mouth care. So we'll talk more about later on in the presentation, when somebody keeps resisting mouth care, what you should be doing. Another one here, March 2021, a lady with advanced dementia had communication difficulties, and the daughter said, I think mum's got oral pain. She said to the care staff, could you have a look in mum's mouth? And they said, no, she looks like her mouth is perfectly fine to us. She looks perfectly fine to us. But when the daughter looked in her mother's mouth, she found that while the top denture was taken out and cleaned at night, the carers had not noticed that she had a plate on the bottom and they'd never removed it for cleaning. So what happened, obviously they didn't realize she had a partial lower denture where it was never removed. The gum had grown over the wires and that denture had to be surgically removed. So you've no doubt heard of the Smiling Matters report that was published in June 2019, where inspectors went into 100 care homes and asked questions to care staff, care managers, residents next of kin about oral health care. One of the questions that were asked to care managers was, how are you using the NICE guidance to look after oral health? And 39% were not even aware of the NICE guidance. So we'll go over the quality standards in a mo. So in the CQC news update in May last year, it said that oral health care is an area of focus in inspections in the coming months. It wrote that on future inspections, we will be focusing on this issue and hope to see improvements on how oral health is improved for care home residents. And our findings will be published in a follow-up report this year. So they're a bit behind with publishing that, and that should get published, I believe, in next month in February. So if you've signed up to our updates, we'll send that out to you when it comes about. Now, 4 months after that was published, 2 oral healthcare questions were added to the CLOEs. And although the CLOEs aren't being used in the way that they were before, when inspectors will be looking at oral healthcare, no doubt they will be looking at the CLOEs questions. One thing I would like to highlight on is, is oral health covered in the induction? CQC would like it to be a mandatory component of oral care training. What I would like to say with regards to the training aspect of things is look at the learning objectives when you're looking for training. So ensure that you've got things like tips and coping strategies for people that resist mouth care. Look at the end of life, palliative end of life mouth care updates, mouth care management, because that was all recently revised. Look at the products, recommended products, and that aspect of things as well. So look at what is in the training. So role of an oral care champion is, I'll just go through these and then go into more detail on each one of these. So ultimately, your role is to increase awareness about the importance of mouth care among the care staff. You need to ensure that the mouth care policy and plans are in place. I'll go through the policy, and I think it's in the next slide. Ensure that all residents have oral hygiene tools and products. Make sure that oral health assessments are carried out for every new resident, regardless of how long their stay is, and incorporate that in their care plan. Oversee that mouth care is carried out. Ensure that staff document that toothbrushing has been carried out and indicate if a resident has declined toothbrushing. And ensure that all caregivers involved in mouth care are trained appropriately. You don't have to be a trainer, you don't have to train the care staff, but you need to ensure that staff that are involved in this part of personal care are confident in carrying out mouth care, especially for people that are involved in end of life mouth care, where you've got lots of these, sticky secretions in the mouth. And it's like, feeling confident in dealing with that aspect of mouth care. With regards to the oral health assessments, ensure that oral health assessments are being carried out. You don't have to carry out the oral health assessments yourself, but you need to ensure that they are being carried out. So oral care policy. In your oral care policy, you need to have in there that whether you provide products and tools or whether the next of kin provide this. Do residents have access to dental care? If somebody needs emergency dental care, you need to have an out of hours number on your oral care policy. It would be a very good idea to build up a relationship with your local dentist. Kind of easier said than done. In some regions, you've got local dentists that are happy to come in, provide domiciliary care or community services that provide a domiciliary service. And then you have other regions that don't, and it's a bit of a minefield to try and get a dentist into a home. So on your oral care policy, if that is a real problem, then just look up your community dental service and put the details of them on there. We do have on our website, you can look up the your local dentists that provide an NHS service. What is your policy if somebody refuses a mouth care? And again, I'll talk about that a little bit later. So with regards to the CQC, which was published in June 2000, well, the best practice came out in July 2016, and then the quality standards came out to June 2017. So quality statements 1, 2, and 3, oral health assessments, recording mouth care needs and care plans, and supporting daily mouth care. So I'll go through each one of those. So let's start off with the oral health assessment. So ensure that mouth care needs of adults are assessed on admission to a care home. Ensure that care staff that carry out the oral health assessment are trained to understand mouth care needs and that they are aware of signs of dental ill health, for example, dry mouth, gum disease. And staff that complete the oral health assessment should have the necessary confidence, skills, and knowledge. So again, when you're looking for the training aspect, ensure that in that training they go through the oral health assessment and soft tissue findings. So you can make your own oral health assessment if you want to. That's fine. It's pretty straightforward stuff on there. Sometimes we get asked whether we can find a dentist to go into a home to carry out oral health assessments. They're designed for care staff to do, or a care lead. They're pretty straightforward. This is the nice one. This is ours, yes or no tick box. And then you've got Mouth Care Matters oral health assessment. As you can see on here, this nice, it's got 0 for healthy, 1 for changes, and 2 for unhealthy. And it's grading the lips, oral cleanliness, the saliva, you know, if they've got saliva in their mouth or not, they've got dry mouth, dental pain, tongue, gums, dentures, do they wear dentures, etc. Do they have teeth? And again, like, look at the lips. Are they smooth, pink, moist? Are they dry, chapped, red at the corners? Are they swollen, lumps, ulcerated, etc.? So it's pretty straightforward stuff. On ours, it's a yes or no tick box. In the 4th column, it's got bits of advice and information for you. And on the Mouth Care Matters, basically similar sort of stuff, really. You can adapt that to your own. You'll find as you can edit as and download it and use it as you can with all of these. The most important thing, as far as I'm concerned, is can that person brush independently, or do they need to be prompted, assisted, or fully assisted with regards to toothbrushing? So the oral health assessments. The next one is recording mouth care needs in care plans. So ensure that care staff provide residents with daily support to meet their mouth care needs and preferences as set out in their personal care plan after their assessment. So how does the resident usually manage their daily mouth care? Check whether they need support. What's their choice of cleaning products? So whatever they used at home, they continue using in their new home. Whether they use Sterident, it's not something that we particularly advocate. I'll talk about that in a sec. They continue using that. Whether they prefer charcoal toothpaste, because that's what they like using, then they continue using that, whatever the case may be. If they have dentures, including partial dentures, they must be stored in a named pot dry. I'll talk about that too. Ensure care staff know how to respond if a resident does not want mouth care, or if they don't want to have their teeth dentures removed. And we'll explain about that. So regards to cleaning dentures. Okay, so the dental technicians that make the dentures advise with regards to cleaning just a mild soap and water. Plaque will stick to any hard surface. So not only will it stick to teeth, it will stick to dentures as well. So just plonking a denture in Sterident, yes, it will make bacteria less virulent. It will kill bacteria to a degree. You know, it's not physically going to remove the plaque. You need to physically remove that with a toothbrush or something physical. So mild soap and water, we get asked, why not toothpaste? just basically because the toothpaste tends to scratch acrylic. Now, like I say, if that resident wants to use a denture cleaning agent, then that's that's their right to do that. But there's nothing on the denture cleaning directions to leave a denture cleaning solution or tablet overnight. It usually says to soak for 20 minutes and not overnight. Basically, it wrecks the denture. It makes the acrylic porous and it's more likely to fracture and break. Now, you're probably quite aware of this, but I will highlight this again. There was an incident where there was a fatality with regards to a product. An 83-year-old resident with dementia went into someone else's room and mistook Esteradent for a mint and was found at the corridor, foaming at the mouth, lying on the floor, foaming at the mouth. And a carer with all good intentions gave that resident some water, which exacerbated the situation, and there was a fatality. So if you are using a denture cleaning, Esteradent, that kind of thing, it needs to be locked away, not stored in their room. Something else that we get asked a lot is with regards to storing dentures. So best practice for denture wearers is to remove their denture at night, storing it in a clean denture pot dry, as studies have demonstrated that leaving dentures dry for 8 hours reduces the fungal population on the denture. Now, it used to be that we used to recommend that dentures were stored damp because we thought that if they were stored dry, the denture would move, it would warp over time. And we now know that if a denture is stored dry, the movement of the denture is so clinically insignificant, it's not even worth, worrying about. There was a paper that came out in August 2020 that shows the study of if dentures are stored damp in water alone, may promote things like candida, colonization, contributing to things like oral thrush, denture stomatitis in the mouth. So we advise that when the dentures are left out, if you think about it, it makes sense, doesn't it? If the dentures are left out of the mouth and they're stored in water, especially if they're left out for a few days, it's going to multiply microorganisms in the water are going to multiply. And supporting daily mouth care. So good oral health is important to maintain self-esteem, dignity and quality of life. Adults with poor oral health often have problems with eating, speaking, and socializing. So natural teeth should be brushed with fluoride toothpaste twice a day, daily care for dentures. Now record that mouth care has been carried out or declined in an action chart. Remind, prompt, assist, return if somebody refuses, refer if necessary. So if somebody is refusing mouth care, so they're refusing. So you've had your training, you've done your tips, your coping strategies, you've gone back, they're still refusing mouth care. Ensure that the next of kin are aware that they're refusing this part of personal care. It then needs to be escalated. It may obviously make all your documents. It then needs to be escalated to a healthcare professional. Now, it doesn't matter who that person is. It can be a dentist, it can be a doctor, it can be a health visitor, a nurse, speech and language therapist. It doesn't matter who that healthcare professional is, but you need to escalate it to someone else. Now, it doesn't mean to say that a dentist will come in, that anyone's got magic fingers. I mean, I've gone into numerous care homes to try and help with people that are resisting mouth care. And, it can be quite difficult and tricky. So, but at least you've been seen to notify someone, to be seen to be doing something about it. So going back to right at the beginning of the presentation where I showed you that care manager that was questioned, and she said, he kept resisting mouth care. So it's if someone resists mouth care, it's not for you to decide, oh, they won't let us brush our teeth, okay, and not deliver mouth care to that person because they keep resisting. You need to be seen to be doing something about it, okay? Escalating it, like I say, to a healthcare professional. So daily mouth hygiene chart. So again, we've got resources on there. You've got it on your electronic devices. Ticking that toothbrushing's been carried out, or a course. If it hasn't, maybe you can only brush one side in the morning, maybe the other side in the afternoon. Maybe you can carry out toothbrushing once a day. That's fine. Make your notes that at least toothbrushing has been carried out. Maybe toothbrushing isn't carried out in the morning. That's not the best time of day for that person. Maybe it's carried out in the afternoon or just in the evening, or at their favorite TV program, or whenever that is. But at least mouth care has been carried out, but do make your notes. And I thought you might find this quite helpful. It's a report from an inadequate service. It was inadequate with regards to the effective aspect regarding to oral health. So this care provider, their oral health assessment consisted of 2 tick box questions. It asked 2 questions basically. One was, do they have dentures? Number 2 was, do they have any sores or pains? And that was it. They made up their own oral health assessments, and they just asked those 2 questions. So the inspector basically said there was no information was taken relating to oral health daily routines, products used, or the person's preferences. And they said the lack of proper oral health assessments put people's oral health care needs at risk. So that's how it was marked as an inadequate aspect. Okay. I would like to just highlight this as well. So sponge swabs are banned in Wales and are on a medical device alert in England. So it's quite well known, there was an incident in Wales where the sponge swab was used by a carer. It was dislodged in the throat, and there was a fatality. In an 18-month period, over 800 incidences were reported where either the sponge head became loose or became detached, and so thereafter the sponges were banned in Wales. They're on a medical device alert in England, has been on there since 2012. So they can be used in England with caution. We do not advocate the use of these sponge swabs, okay? If you want to hydrate the mouth, using a toothbrush with water is completely adequate. There are other things that we do, recommend instead of the sponge swabs. But if you are one of these hospitals or places that are using the sponges and insist on using them, again, not that we advise that you do, but out of the 2 types, there are the pink and the green. The green sponges are glued onto the stick, and the green sponges are heat bonded onto the stick. So out of preference, I would veer more to the green because they are more secure. And lastly is oral care training. So CQC advise that, like I say, it's a mandatory component with regards to your training. And as you know, we deliver the training, that's kind of all that we concentrate on, really. But in the early days, we just delivered an oral care service. So we went into care homes delivering mouth care, basically. And we go back, every time we go back into the home, sort of a week later or however long the interval was, in between those two times, those visiting times, mouth care was still not being carried out by carers. So that's why we went into the education aspect of it, and delivering importance of why what is plaque and why plaque needs to be removed, basically. And like I say, we go through the tips and coping strategies for people that deliver, the tips and coping strategies, palliative end of life mouth care, which was revised recently, and all those aspects really, and the oral health assessments, like I say, the soft tissue findings, etc. So you've got just a brief. You've got your role is increase the awareness of the importance of mouth care, ensure that everyone's got your organisation, your home has got mouth care policy, that everyone's got tools, that they're all charged, electric toothbrushes are charged, that oral health assessments are being carried out for every new resident, regardless of how long their stay is, and incorporate their mouth care needs into their care plans. Document that toothbrushing has been carried out or not, declined, but it needs to be documented, and ensure that staff have been trained appropriately. And again, you don't have to be that person that delivers training. Again, you don't have to be the person that delivers the oral health assessments. Okay. So we've got, with regards to the club compliance aspect of things, we've got a form that you can fill out to us, and we'll let you know whether you're doing everything right. Basically, got whether you're compliant, and if you are, we're happy to give you a certificate. But you do need to ensure that you are delivering ongoing training to your staff, that all new staff have got are educated basically in basic oral health care. If you are having ongoing, excuse me, training with us, we will complimentary, provided you're can demonstrate all the other things, we will we will certify you basically to ensure to show people that you are compliant in oral health care. So we do run live webinars for people that are on a enroll all care staff plan. We run live webinars a couple of times a month, and whoever attends them are certified. We send you the certificate to your home, and we've got e-learning as well. But we also, I mean, we cover everything. We do if you want a local hygienist that comes out to your home, we deliver face-to-face webinar sessions. A trainer is quite popular as well. Again, with the trainer course, if you've got a staff member that's attended our trainer course, provided you can demonstrate that you're delivering you're delivering training to your staff, and we'll go through the CQC aspect and look at certifying you with regards to oral health care. So that's basically what we do. Yeah, I hope you found that all helpful. What I'm going to do now, this is, if you want to get in touch with us, this is our email address and our website, and I'm more than happy to answer any questions for you. So let's have a look. We've got a few questions in the chat box.